Oklahoma continues to hover near the bottom of two new national health rankings. Healthcare professionals who testified at an interim study at the state capitol say while many factors contribute to the poor health outcomes, what the state needs most is better access to health care.
According to a recently released study by WalletHub, Oklahoma ranks 44th overall out of 50 states and the District of Columbia for health care and 47th for health outcomes. Meanwhile, an annual report from America's Health Rankings puts Oklahoma in 45th place for health outcomes, a slight improvement over last year's ranking of 46th. Both reports cited lack of access to health care as a major factor in the state's poor rankings. Eric Pollock is Vice President for Administration and Finance at Oklahoma State University Center for Health Sciences. Pollock told a legislative panel that one problem Oklahoma faces is a critical shortage of doctors, especially in rural areas, something that won't be fixed anytime soon.
In order to reach the national average in physicians, Oklahoma would have to increase our number of physicians by 1,300 tomorrow.
According to Pollock, the federal government has designated 64 of Oklahoma's 77 counties as a health professions shortage area. Further complicating matters is the fact that many of our primary care physicians are aging.
55% of primary care physicians located in rural areas of the state are aged 55 or older, with another 27% that are older than the age of 65. So not only do we have a current access problem, we have a replacement issue that we have to face and have to be actively managing as we go forward in the future.
The university is working to address the physician shortage through programs such as Operation Orange, which encourages high school students to consider the sciences and, in particular, the medical field.
They interact with our faculty. Our medical students go through a day of what it's like to be in medical school, hands-on activities, things along those lines to try to then not only spark their interest, but then give us a way that we can keep in contact with them as they continue on through high school, make sure they're taking the right classes as they get to college to be prepared to be good, solid applicants, successful applicants to medical school.
Another effort to increase the number of healthcare professionals is taking place at Oklahoma State University, Oklahoma City. The U.S. Economic Development Administration recently gave the school a grant to buy high-tech equipment for the recently completed Allied Health Building. OSU OKC President Natalie Shirley says the funding helped to purchase technology and supplies for a training simulation lab, including life-sized human mannequins that can be programmed to appear like a real patient.
With this grant, OSU Oklahoma City will be able to expand our training opportunities and change the way healthcare training is done in Oklahoma. This will benefit students, it'll benefit the community, and ultimately it'll benefit the state.
EDA Regional Director George Ayala says the building will also serve as a community health center for low-income patients.
And I believe the estimate is about 2,000 folks a year in underserved patients are going to benefit from this facility, which is just kind of a cherry on top.
Such community health centers have played an increasingly important role in providing health care to low-income Oklahomans. But Brent Wilborn with the Oklahoma Primary Care Association says those centers have suffered cuts in state dollars.
That funding reached a peak in 2009 of about $3.8 million. And we've had roughly the same cuts as the health department who manages that fund proportionately every year since, to now $2.31 million. At the same time, we've had 8 to 10% patient volume growth every year.
One factor that would have a substantial impact on health outcomes is access to health insurance.
Regardless of the source or the mechanism, we know that that significantly improves access to care, adherence to care, regular source of care. We know that that has a dramatic impact on the ability to manage chronic illnesses.
But access to health insurance is another area where Oklahoma comes up short. A study released last week by the U.S. Census Bureau shows 13.9% of Oklahomans went uninsured in 2015. While that is down from 18.9% in 2010, Oklahoma remains in the bottom 5 of all states in access to health insurance. State Representative Sean Roberts, who called for the interim study, said lawmakers would consider ways to increase insurance coverage, but expanding Medicaid is not one of them. We are currently one of 19 states that haven't expanded Medicaid. Is that anywhere on the table?
With what happened in previous legislature, I don't see that happening here.